healthy and whole.
In mind, body, and soul.
I'm Shawnee Presley.
And I'm Dr. Leo Presley, or Dr. Leonard Presley, but everyone knows me as Leo. Welcome again to another show. We're glad that you joined us again for this show here. It's February 2022, and already 2022 is proving to be just as adventurous and eventful as the past 2 years. I hope everyone out there has been safe since we last saw you. I hope everyone is doing well. And this month, we have a very special topic. We are talking about
heart health, and I am dressed for the occasion.
Yeah, you always dress for the occasion. If y'all saw her closet, y'all would know why she can always do that. But we are talking about heart health this month. We really want to focus in on this. Heart health is a very important, not just because it's an important organ, it's because it causes so many health-related problems. You know, just some very general stats. One life is lost to cardiovascular disease every 36 seconds in this country.
Wow.
That's over 659,000 lives lost to heart disease of some type in this country every year.
Wow.
This is something we really
our community in regards to heart health.
need to do our best to get a grip on, and we know that it disproportionately affects our community.
Yeah.
So we really want to take our time and we really want to tune our ears in, take notes, think about yourself, what you can do, because this is something we really need to tap into and learn a lot from. Another stat that kind of blew me away as we were preparing is there's a heart attack in this country every 40 seconds. So every 40 seconds, somebody is having what doctors may call a myocardial infarction. Most people call a heart attack every 40 seconds in this country. So this means we really need to take this serious. We really need to do what we can to make our heart stronger, because if the heart's strong, then the rest of the body can kind of catch up.
Those details are pretty shocking.
That is very shocking, and it's very serious, but we want to make sure that's why these shows are here. This show is designed and purposed. It was the brainchild to bring this kind of information to our community so that we can make better health decisions. We can be more engaged. We can take more control, because most of us being those watching, and kind of the birthplace of this was in our community, in our faith community, our faith-based community.
Yes.
And so many of us spend a lot of times taking care of the immortal soul.
Yes.
But God wants us to be good stewards of everything. So he wants us to take care of our body. That's why the title of the show is Healthy and Whole in Mind, Body, and Soul. Before we get started, I want to thank Pastor John Wyatt.
Are we supposed to say we're going to take a short break for our sponsors?
No, we're not taking no breaks this time. Not this time. We're gonna, but we want to thank Pastor Wyatt and his First Lady, Sister Paulette Wyatt, the Brooklyn 265 congregation, the support team, the production team, Brother Johnny Morrison, Sister Pamela Morrison, all of those on the committee there that make this show happen. We were so blessed to be a part of this venture. We've enjoyed it, and we want to thank them for their support. So now if you want to thank them, you can write them a note, but a good way to thank them is to hit the like button on this video, subscribe to the channel, turn on the notification button. All of that stuff shows that you appreciate the work that's going into putting this content out there.
That's a great way to show your support.
Show your support. And leave comments, leave questions. And if we can get to them, what we'll try to do is incorporate those into our next show. We might have to start out with a Q&A session if we get a lot of questions on this show.
That works.
But let's jump into the heart. Let's get to the heart of the matter, if you will. That's nice, right? Me and my play of words. Now, I want to let everybody know I want you to tune in, not just because this is a heart episode and it's very important, but we have a superstar of a guest tonight.
Yes.
We have a young lady that is supremely talented, supremely just accomplished, educated. I mean, just everything, every adjective in the book that tells you somebody is doing a great job at everything they set their hands to, and is climbing the ladder at a tremendous pace.
At an alarming rate.
It's not alarming, it's tremendous. It's encouraging, but it is a blessing to have.
She is a dynamic person.
She is a dynamic person, a person who is dedicated to her craft, to taking care of people. And she has dedicated her life to doing that in so many different ways, and it has taken her to some amazing heights. So before I bring her on, I want to give you a little bit of her background. She Her education has included a bachelor's of science in nursing from the Medical University of South Carolina. She received a master's in public health administration from the University of South Carolina, but that wasn't enough. Not yet. That's later.
Okay.
And then she got her executive master's of business administration from the University of Florida. Go Gators.
Yes.
And then she received her doctorate of nursing practice from the University of Miami. Again, educated, prepared to do battle in these fields, to be the best in healthcare, to promote it to the best. She has held positions such as the Chief Operating Officer and Chief Nursing Officer for Baptist Health in Jacksonville, Florida. She was the Executive Director of Nicholas Children's Hospital System, which is also in Miami. She held Vice President and Chief Executive Nurse positions for SSM Health in Wisconsin, HCA Healthcare in Tennessee, and is currently serving as the Executive Vice President and Chief Nursing Officer for the state of Illinois for Ascension Healthcare.
Wow,
she's
made it all
she
over
has
the world.
done everything. She's rubbed elbows with Dr. Oz. She has done TED Talks, all kinds of stuff. And she has agreed to come on and help us be more healthy and whole in mind, body, and soul, to talk about the importance of heart health. I want to introduce to many and and present to so many that do know her, Dr. Veronica Scott Fulton. Thank you so much for joining us tonight.
Thank you. Wow. Is that me you're talking about?
That was you, girl. That's you. That is you, Mama, and you alone.
Mama would be so proud.
Yes, she would. Yes, she would. She would be smiling so big her face would be hurting. I know it.
Yeah.
How are you doing tonight?
Doing extremely well. Right now it is snowing outside. I think we got about 6 inches of snow. But now that I kind of got used to the West Coast, or kind of Midwest, I've kind of gotten used to some of this weather. But you know what? To God be the glory. You know,
Amen.
Whatever is out there, whether it's raining, whether it's snowing, whether the sun is shining, you know, you really just have to bring your authentic self and just bring that humility to help, to foster, and to innovate greatness among humanity.
Wow. Now I'm going to ask a question that's kind of career oriented. You started out as pursuing a degree in nursing. How did that love of caring for people lead you to where you are now? Yes. Like, how did you go from maybe just most people think of a nurse as working in the hospital hand to hand with the patient. Mm-hmm. How did your passion for taking care of people take you from frontline patient care to being executive vice president and chief nursing officer for Illinois?
Well, you know, I think it all started when I was in church. I feel like it started with Aunt Sally. She was a nurse, and I remember her coming to church with her whites on, just looking amazing. And then I got the opportunity to work with my Aunt Gail, your mom, at the dialysis center. It shaped something within me. I felt like I had found my calling. I felt like this is where I belonged. And isn't it amazing that it started in the places that I love the most, being in the church, and then being in a clinic with my aunt who was mentoring me and really explaining how this works and how you should show passion to populations that may be marginalized, that may be sick, or that may be in a place where they're very, very frustrated because they actually have to come to a dialysis center. It actually all started there, really close to my home, with my aunt being right there. And when I became a nurse, I continuously had people who said, you know, you really have a voice, and it seems like you don't mind speaking up. You know, why don't you use that voice to elevate the whole framework of nursing? And then it got to the point where it wasn't just nursing, it was our partnership with clinical operations and really trying to make a platform that helps all of us. So, and I will say what I'm really focused on now is diversity and inclusion. COVID really sound the alarms because all of those chronic illnesses that had never been taken care of, especially by those that are marginalized, the Black and the brown populations, those living in red line areas, it really showed its face. Because when we saw the death and dying, we saw it mainly among that population. So more and more and more within the hospital realm, within the clinical realm, we are pushing to have just care for all races.
That's wonderful.
Yes, that's exactly
wonderful.
What's needed.
Just care for all races. And it's amazing how in 2022, when most people thought, it was crazy to think that we thought we would be so far advanced right now that 2020 was the year that George Jetson was supposed to be born. And we thought we would be so far ahead and so advanced that we could put a lot of these things behind us. But it seemed that these factors that leave certain populations and certain groups without preferred access still cause so much problems today. So it's great to know that that there is a voice such as yours trying to make a change in that area. That's wonderful to know.
May I ask, how challenging was it for you to get to where you are now?
It was not easy. I'm a female, I'm Black, and I'm from the South. So you would think in this new age world that we live in, the fact that we live in the richest and the most prosperous country in the world, that those opportunities are always available for everyone.
Right.
If I would have listened, I would have never moved. I would have never tried for the position because so many people told me, oh, you'll never be a chief nursing officer. You'll never get to this level. You'll never be a corporate nurse. I mean, I just got a lot of interesting comments and feedback along the way. But you know what? My mom told me I can be whatever I wanted to be. My mom told me all I needed to do was trust in the Lord, have faith, and live in that supernatural. If that's what I wanted to do, that I could achieve it. So I listened to my mother, and she was right. I mean, I had dark days where the tests were very, very hard. I was tired. I was raising children. I was married. I was trying to do all of this stuff, almost trying to be a superwoman. And it gets very, very hard. But I always had my family that I could lean on. I always had great motivation. And also, I did have people within the hospital realm who was rooting for me, who was saying, Veronica, I'm going to help you along. I'm going to talk to this individual and tell them how great you are at what you do. And perhaps you will get that opportunity. But when I really think about the journey, I think it was really a spiritual journey. It was one that you have to believe in something that you've never seen, you've never been a part of, but you feel that you're going to make it, that you're going to be in those positions, that you're going to sit at the table. And not only are you going to sit at the table, you're going to make a difference for people who look like you, who've grown up like you, and who's trying to use you as a role model. So just really trying to be very, very positive and allowing not just myself to excel, but when I see other people that need help that are Black and brown and maybe going through those struggles, I can speak up for them. I can give them a job. I can help them along, just like, like it worked for me. So I feel like I'm not just here to be here. I'm here to make a difference.
That's amazing. Well, sorry, my co-host had to step out for a moment. But all the information you gave us, you broke barriers that a lot of us have to deal with. And I'm not even going to say as an African-American woman, but as women in general, we all have to fight to try to get to a place where other people could just walk into. And I like that you said that it was a spiritual journey, because our whole lives are spiritual journeys. But let's get back to heart health. Come on in. Come on in. Come on in. Let's get back to heart health. Are you ready for the first question?
Absolutely.
Okay, so it states, in your recent experience, what are the most pressing issues facing our community in regards to heart health?
The most pressing issues, number one, the food that we eat, the amount of food that we eat, the fact that we need to move our bodies more, and we need to drink more water. Not soda, not tea, not coffee. I mean, it's the simple things. I think people think that, no, you need to eat well, you need to move your body, and you need to drink water.
Right. So when you say eat well, let's start there, because that's a big one. No, other than what we need to do to eat well, why does eating impact our heart to such a degree that it is so important for us? How does our diet, why is it such a major factor in heart health?
Yeah. Well, everything you eat really affect not only your heart, but your brains, your cells. And what you need to focus on is whole foods. When you eat foods, and I always say foods that God made, or what God replenished the earth with, which is water, it actually nourishes your body. It feeds your body. It helps your body to heal itself naturally. It doesn't cause inflammation. It doesn't disrupt your systems where, you feel indigestion or you're feeling very, very heavy. You must eat the right foods, because that will help you to live a healthier life, and it'll help your brain and your heart to work more efficiently as you get older. So it's very, very important to realize that not just from a spiritual realm, you got to take care of the temple. So that you feel good. I mean, sometimes, people talk about arthritis, that's inflammation. Sometimes people are feeling that their knees and their bones are hurting. And a lot of that has to do with maybe obesity pressing on your frame. So as much as possible, you need to take care of your physical body, because it'll help you as you're trying to live a stronger spiritual life.
That is so true. That is so true.
When you say whole foods, it brought me back to when you ever hear those commercials, you got to go into the outside area of the store.
Right.
Where all the real food is.
Right.
You understand what I'm saying?
Not in the aisles, right.
Yes.
Right. So when you say whole foods, take our normal Sunday dinner. If you were preparing a healthier Sunday dinner for us than what is traditionally known as our soul food, our cultural food, what whole foods would you recommend we implement rather than the things we eat mostly?
When I think about Sunday dinner, if I think about my childhood when I was growing up in Kingstree, South Carolina, I'm thinking about barbecue chicken, macaroni and cheese, cornbread, okra, and some butter beans. And the thing is, you can still eat those things, but they just have to be prepared differently. Chicken is fine, grilled, barbecue, maybe not so much of the barbecue sauce, because usually that contains a lot of sugar. So just making sure that you have an adequate amount of sauce. Macaroni and cheese, that's a little tough, because first of all, that's a lot of white flour. Most African Americans, because we're O positive, we have such a huge disruption to milk products, to cheese, to dairy. So we have to be really, really careful. So one of the things, if you want that macaroni and cheese, it needs to just be a couple of tablespoons. Doesn't need to be a lot, because what it's going to do, it's really, really, really going to take a long time to digest in your body. And all of that white flour is going to create paste in your system. And so you really don't want a lot of that. You know, when you think about cornbread, cornbread, again, the white flour, you got the eggs, you got the oil, still a lot to digest in your system. So what I consider as that Sunday meal is really something you should probably only eat a small portion of once a month. Your diet should consist of fruits, a lot of vegetables, and as much as possible, a big bowl of salad. With just maybe just a little oil and vinegar, not too much of the dressings, because a lot of times the dressings also have a lot of sugar, a lot of salt. So you want to actually make your own dressings versus picking up the ones that they already have in the store. And if you pick up the ones in the store, you need to get the ones that's in the freezer section or in the refrigerated section, because the ones that are just sitting on the aisle, they have really, really, really strong oils that doesn't always digest well in your system. And it really just gives them a long shelf life of sometimes 5 years. So you don't really want that in your body. So what you should always do is start with a big bowl of salad, and then your fruits, your vegetables, and then you could look at the palm of your hand, and that is the amount of protein that you need to eat, and then water, not soda, not Kool-Aid, not diet drinks, but water. That'll help your body. It'll soothe your body, and you'll feel better. You'll be able to move around better, and you'll be able to maintain your weight more successfully.
Wow, those are awesome tips. Those are awesome. That's awesome information. So now we talked about, let's move to the second factor you talked about, moving your body. Mm-hmm. Now, is it the amount of movement, the type of movement, the frequency of the movement? What are some guidelines you would, just kind of general things we should look for when we talk about moving our bodies to stay healthy?
Yeah. Now, I think, sometimes there is a precedence where people feel like, they have to go to the gym and work out for an hour. For young people, especially people 30 and under, you really do need to get rigorous exercise in, where your heart is higher. When I think about the times when I used to go to Orange Theory, you could monitor your heart and really try to make it strong, make the body and the blood flow really, really well. And the other thing it'll do is open up your brain. So sometimes instead of taking antidepressants, you can get the same feeling of dopamine just by working out. So one of the things you need to do just overall is try to get 30 minutes in a day. And that could be running, that could be walking. You can figure out what would work best for you. A lot of times just walking really fast and using your hands and your arms very, very quickly for 30 minutes will give you an adequate amount of exercise. And then when you couple that with the whole foods and the water, you're really building a strong body of health. So you really need to exercise. You really need to do it at least 30 minutes. And if you're a person who is working from home or working from the office, you need to stand up versus sitting down. What they're considering right now, that standing really, really helps to keep the body flowing, to keep the blood flowing, versus sitting down, which they consider as the new smoking. So you really need to keep your body very, very active.
Wow. So sitting is now the new smoking, huh? Mm-hmm. That's scary. Yeah. That's scary.
Yeah.
So as much as possible, if you're you can set your timer every 15 minutes. You can sit for 15 and then stand for 30. and then sit for 15 and then stand for another 30. But really, as much as possible, do not spend so much time just sitting, watching TV in front of the computer, since a lot of people are working from home. You really need to probably get a stand-up desk and stand up.
Mm-hmm. Wow, that's awesome.
So when just thinking about what you just said, well, our children are in school, 6-7 hours a day, and they're sitting most of the day. So it's like we're training them to smoke, like you said, sitting. So that's something people need to look into. Have you ever thought about that?
Well, it's so interesting that a lot of schools, they have classes that are usually about an hour. Now, sometimes the little kids, it's a little different, but what they try to do is have centers of education that'll last an hour, and then give the kids a different kind of fun activity where they can sit down on the floor, sit Indian style, or they can do some yoga stretches. I have a lot of teachers in my family, and they are such a blessing to me and to really all of the whole world, because what will we do without teachers? But what they're doing is they're integrating a lot of times those yoga stretches and poses into the daily formation of work within the classroom.
That's awesome. That's great.
Yes.
That's really good. Now, another question specifically about heart health. If somebody has a diagnosis, if they already kind of, they've had some bad habits leading, up to this point in life, they already have some, some building health issues. What are some of the things you would recommend for them to manage or to improve their heart health once things have started to kind of deteriorate a little bit?
Yes.
Well, if they already have a diagnosis, when I think about my own mom, she had blood pressure issues that were elevated for a while. So it led to congestive heart failure. So if you already have a condition, be mindful, take your medications. She was always on like antidiuretics to help keep the fluids level appropriate. You need to watch your blood pressure. So we always had blood pressure cuffs at the house. So you're always mindful of that number. And again, even though you already have the disease and it's diagnosed and you're under a doctor's care, you really still need to keep the disease from exacerbating more. So you need to eat the whole foods, you need to walk, and you need to drink as much water as possible.
So, and I'm very glad you said that, because I know a lot of people, when they get that diagnosis or when they hear you're pre-hypertensive or you've got hypertension or you've got some congestive heart failure, they kind of resign themselves to the fate that I'm just sick now. Yes. So there's nothing I could do. So I'm so glad you brought that out, that even if you have the diagnosis, you can still manage, you can still minimize the effects of it by working at it.
Yeah. And the thing is, you got to think about your quality of life. You may be in your 50s, your 60s. If you can keep those numbers under control, if you can keep your stress level under control through prayers and meditation, and maybe even listening to your favorite music or walking out in the park while the sun is shining. But you really do have to think about your quality of life and how you're going to be living as you go into those golden ages, into the 60s and 70s. Because what you want to do, you want to be at a place where you can still walk and be active and still go to church and take care of your grandkids and still travel and do all the things that really makes you happy.
Very true. That is so true.
So let's backtrack just a little bit about, you said the diagnosis for adults, but what about children? What about children? What about if your child is heavier? And sometimes it's not your fault that your child is heavier. Mm-hmm. How can you help that? Because some of them may have type 2 diabetes, I think children may be diagnosed with. How can a parent help with that?
And you're bringing up another pandemic that we have, especially here in the United States and abroad, and that is obesity among children. What we're finding is that parents, they don't cook as much. They're buying a lot of sodas and a lot of juices that have a lot of sugars. The schools, they don't have the healthy meals anymore. When I was going to school, people were actually cooking food. So the kids are eating a lot of calories. They're eating out a lot, pizza, hamburgers, French fries. So we are seeing a pandemic of morbid obesity among our youth. With those children, and I, even my little Scotty, who's finally getting it together. I can remember us going to Kaiser when he was about 8 or 9, and the nurse practitioner saying to him, you know, you got to eat less food, you got to move more often, and you cannot eat until you feel, you know, not hungry. You always have to feel a little bit hungry, because what we're finding is that the kids are having strokes, the kids are having heart attacks, the kids are having issues with quality of life, type 2 diabetes, and not only that, they're getting teased in school, they're getting made fun of, which is causing a lot of mental health issues. So we have to bring it back. We're going to have to start cooking. Mom and dad, we cannot eat out every day. You cannot go to fast food places. If you're going to eat fast food, it should be once a week. And it should be a very, very small meal. But you need to go to the grocery store. You need to cook your meals for you and for your children. We need to go back to that, because eating out, you don't know what's in it. You don't know what they put in it. When you get to endeavor and make your own foods, you're controlling the portion sizes, you're controlling the additives. We are going to have to get back to that. And as much as possible, you need a big bowl. Everybody gets a big bowl of salad. It always starts with a big bowl of salad. And I would tell you, even though right now I'm 52, sometimes for breakfast, I still have a salad. Sometimes for lunch, I still have my salad, because you need whole foods, fruits, and vegetables that God made, that's not created in a factory somewhere, that doesn't have all of these ingredients. So as much as possible, get in those fresh foods, water that's pure and good. You know, you don't have to buy it. You can just get it, put a couple of cubes of ice in it, and drink that water. It makes a big difference. And we're going to have to do it for our children, because right now they're seeing that the life expectancy of our children have decreased because of all of the eating out and the fast foods and the fact that kids are drinking a lot of sodas.
Wow.
Oh my God.
That is so scary. So it's on both ends of the spectrum.
Yes.
The young people are suffering with all of these heart diseases because of bad eating habits and exercise habits, and it's following everybody else from there on both ends. So this is very important that we get to take these words to heed, everyone. Take them to heart and put them into practice, because we really need to do something about it. Next question. If thinking about heart health, what are some of when you think about the underlying factors or things that may have been precipitated by health disparities, what are some of the things that may cause our community, other than our diet, what are some of the other factors that play into our community suffering disproportionately with heart disease?
You know, this is such a good question. And the other part of heart disease is stress. And I would tell you, as African Americans, stress really causes a lot of chronic illnesses, or it exacerbates it further. I mean, and I know people feel like, oh, we've had Barack Obama as a president. There's been a lot of civil rights that have improved for African Americans, but there's still a long way to go in this country. When you look at implicit bias, when you look at the way African Americans and Black and Brown and Hispanics are treated in the country. You know, sometimes even for me, you know, there have been times when I've gone into certain apartments and people are asking, you know, do you live here? Certain meetings I've gone to, and they've mistaken me as the person who should get the coffee. They've seen me walking to the room and wondering, now, who are you? I asked for the chief nurse. All of those microaggressions, they also cause a lot of disruptions in health. As they build up over time, people just get tired, they get angry, and it does affect their health. One of the things about Black women, we have the highest cases of infant mortality. We have the highest cases of morbidity, and that is when women are having babies, and because of certain illnesses that have gone undiagnosed, or they're not paying attention in the healthcare realm, we are dying after having our kids. A lot of African Americans, Black and brown, marginalized populations, we do not have health insurance. It's hard to get proper health care and follow up when you do not have health insurance. So those things have really made things even more difficult when you look at heart disease, stroke, cancer, and just when you're trying to live a peaceful life and you're always bombarded with some form of racism.
Right. Now, and I'm glad you talked about that, because one of the things we talk about is healthy and whole in mind, body, and soul. And we've talked about this in previous shows, where all of our health is so impacted by our state of mind. And we've talked about in several shows about the use of, with us being spiritual, we pray, we believe, we go to God, but we've also begun to advocate for meditation, for mindfulness practices. Is that something you recommend to deal with this barrage and constant onslaught of stress that we may experience?
You know, Leo, absolutely. I mean, and you should have your prayers, you should have your meditation, and you should go to Wednesday night Bible study. You should have your circle of friends where you can feel comfortable and be your authentic self. You really need to be in environments where you feel peace. Whatever your favorite music is, you need to figure out what that is, because they have found that music soothes the soul. And the other piece is of course yoga and exercises. A lot of times just stretching, closing your eyes, imagining yourself on the beach. Those things will help you to feel calmer and help you to feel better. You just need to find those things that work for you. And with that can all be a part of your daily meditation, where you sit down and you get out of all of the things that are just running through your head, anxiety driven. You think about your initiatives and your strategies and your schedules and the things you got to do with your kids, and you got to run over here and all the things you have to do with your job. You need to turn all of that off for 15, 20 minutes a day. Just focus on self. Powerful.
Yeah, that's great. That is very powerful. Very, very powerful. Next question. How do we approach is there a more effective way to approach the healthcare system as African Americans to get the care that we may have been lacking? Because one of the reasons, like you said earlier, that heart disease and strokes and all of these things are so rampant in our community is, disparities in access. And because we haven't had access, sometimes folks are uncomfortable trying to navigate the healthcare environment, because typically it's not a place where we spend a lot of time. What would be your advice for those who may be struggling with some heart problems or have family history of heart problems? How should they approach the healthcare system? What is the best way for them to get effective healthcare to help them with their heart?
Now, I will say that our country has made great inroads with community-based clinics. So one of the things that we found, and there's great research and evidence that showed that this really, really works well, is to set up practices and set up clinics in the area, in the community in which people live, and then connect them through the clinics. If they find that you have a disease process that's advanced, then they can use a lot of their resources, because a lot of these are faith-based organizations, or they have government contracts to help those that need additional help or who may not have health insurance, and they can connect you to the larger hospital systems. So I would say start at any health community-based clinic. They're usually right there in your neighborhood, or even going to those physicians that accept Medicare, Medicaid, because they can also help you navigate through a more complex health condition.
Wow, that's a great idea. That's great information, because I had not really ever thought about community-based clinics.
Yeah.
And not, I just always thought it was a clinic in the community. I didn't think about that it was meant and designed to draw those people from that community specifically and be their gateway, if you will, into the healthcare community. So that's great information.
A lot of people.
And you're still correct, because a lot of people, they don't feel comfortable leaving their community. But a lot of time, if dentist is right there in the community, if they're a part of your community, they're a part of your church, they're a part of your circle of friends, you don't feel ill at ease going to them, because more than likely they look like you, they understand your culture, and they respect who you are as a human being.
Very true. That's great.
You literally took the words right out my mouth.
That's great. That's so good. Yeah. So, but it's kind of sad that we still need that, but it's better to know that it's there, that those resources are coming along for us. So that's a good thing.
And I think that's something that the church as a whole should get more involved in, because sometimes you have people in your own congregation that need these assistance but don't know how to access this assistance. Do you understand what I'm saying?
Very true. Very true. And I think that's why Pastor Wyatt and his team thought this show would be a great way to get this kind of information to his congregation and other faith-based organizations, is because we just don't know. And sometimes we just, and it's sad to say, but we go, oh, just pray about it. Well, if God gives you access to the things to help, you got to stop praying and start going.
Exactly.
Well, keep praying and then go.
Yes.
That may be a better answer. So,
yeah, and a lot of it is cultural. A lot of us grew up, maybe not eating all the right foods or even the way they're prepared. But we're at this point we're adults. A lot of us have our own children. We have our own circle of friends. So we need to come together, and especially within the realm of the church, and make sure we have classes on healthy eating, preparation of food, and being mindful of the temple. Because, if you're sick, it's harder for you to praise God. If you're not able to walk and move your body, it's harder for you to praise God. If you're feeling ill at ease because of headaches or body pains, it's harder for you to praise God. So one of the things that we need to connect our congregations with is to keep that body healthy so we can help those in our community, not just from a spiritual realm, but just helping them do the things that they need to do. And not only that, it's a good example for our children. And maybe our children won't have to suffer with the same diseases we did because of lack of activity and the lack of eating proper foods.
Very true. Very, very true.
With you being entrenched in the medical community right now, what are cutting edge technologies that they're using to help with the heart health, the obesity, the diabetes? What are the new things that are coming out that we don't even know about yet?
Well, the biggest innovations that they're looking at is, when you look at the iPhone, the iWatch, and all the things they call it. I'm not on top of it like my teenage or my 20-year-old college kids, but really tracking and monitoring your steps. Because, there's always, I think about the women who I work with. We're always trying to get 10 to 15,000 steps in a day. So sometimes it may not be overly highly innovative, but just looking at your steps and using that as a motivating factor to keep on moving your body.
Right.
The other thing that you can track is your fluid intake. You know, it's so amazing how many people do not drink water. You have to drink water, people. You have to drink water.
Guilty as charged. Guilty as
I
charged.
know. You got to stay, and you have to, stay away from sodas. I don't care if they're diet sodas. Stay away from all the artificial flavorings. We have to really learn how to drink water. It cleanses and detoxifies the body. It cleanses the skin. It makes your hair better. It makes your head feels better. It makes everything feels better, but you can't feel better if you don't drink it. And when you mix it with all these other things, especially when it's filled with sugar and caffeine, it doesn't really generate well as much in your body. So it is really the simple things. It's the simple little things that we have to do to help us with heart health.
Very true. Very true. Well, you know what? I think that is a great place for us to say we have to eat better, we have to move our bodies, and we have to drink more water.
Lots and lots of water.
And that seems to be the wrap up way. And you know, I love that because with the statistics given at the beginning of the show, you would think these answers would be so monumental and earth shattering, but it really boils down to doing the simple things consistently to improve our heart health. Would you agree with that?
Absolutely. Absolutely. You know, and because what happened, it builds up over time. So you're in your 20s and everything is great. You're in your 30s and, you know, by the time you get to your 40s and 50s, it catches up with you. So it's better to really start those good practices now. You know, like even in the church, instead of having some of the fried fish, maybe we could, put it on the grill and we can have some salmon. Or instead of having sodas, you get bottles and water. Instead of having so much cake, we can have fruit, or we can have apples and oranges that we cut. So we can actually start some of those practices in our daily walk, not just with God, but also with our family.
Very true. That's so true. Well, Dr. Veronica Scott Fulton, we have been blessed to have you on the show tonight. Thank you so much. I know you are extremely busy with all of the things you must be responsible for, but thank you for taking your time to help us understand how to implement what turns out to be very simple steps to improve what has been such a monumental problem for us. So thank you so very much.
Thank you.
All right. Now it's time for our daily healthy living tip of the month. Of the month. Do you have one to share this month?
I think our guest gave the best one. Drink plenty and plenty of water.
Well, what if I don't like water? What do I do?
Add lemon.
Fresh lemon or like concentrated lemon?
Fresh lemon.
So water with lemon. Okay, that might work. All right, so my daily healthy living tip, with it being Heart Health Month, one of the things that our guest has spoken directly to is how stress really, really negatively impacts our heart health. Overall health, but definitely our heart. I was listening to and studying some mindfulness meditation podcast and reading some articles on it this week. And it said as little as 10 minutes a day of sitting and paying attention to your breath, allowing your mind to slow down and stop, has shown that it has had dramatic, in research study after research study, lab study after lab study, it has shown that simple, short intervals of mindfulness meditation. This doesn't mean you have to go to a studio. This doesn't mean you have to buy special books. It's simple. And the crazy thing is, most smartwatches now, they have built-in breathing exercises. That doing these exercises lowers blood pressure, lowers the frequency of cardiovascular disease, lowers the impact of diabetes, lowers our chances of stroke. So my heart healthy tip for this month, my daily living tip, is find a podcast, find a on your iTunes or Spotify, find some short mindfulness meditation tools and use them as much as possible, because this world is so stressful. that even sometimes we do all the right things, just the stresses of life can impact our heart. So use mindfulness meditation to really help keep your mind, body, and soul healthy and whole. All right. So I think that wraps up our show for this month.
Yes. Thank you guys for joining us. Thank you, Dr. Veronica. I always say Veronica because that's how I know you.
That's our fam. She's fam, y'all. Y'all didn't figure that out. She's fam.
Yes. You have been an amazing guest, and you've given us information that is so simplistic, but so impactful in our whole daily life that we can do and don't need a whole bunch of money to do it.
So, Dr. Fulton, do you have any closing remarks before we leave?
I want to tell everybody again, get you a nice big bowl and salad. Every meal starts with salad.
Very true. I love it. Salad. And you know what? I will say that my lovely wife has done a great job. Our boys will not complain if we have salad for dinner. They are perfectly fine with that. And that's all. So they are on the right track. They are on the right track. Well, thank you so much again. And I want to say a congratulations. We will continue to pray for you. It is such a reassuring thing to know that we have a voice such as yours at the level in the healthcare community, because the more voices we have like yours, the better our community will be. So we're praying for you. We're behind you. We're supporting you. And thank you so much for all that you do and for being here with us tonight.
Thank you.
All right. Well, we will see you all next month. And we pray that God blesses you, that God keeps you healthy and whole in mind, body, and soul. And we will see you again next month. Thank you. Be blessed. We'll see you next time.
Bye.